My name is Chris Phillips. I chair the insurance subcommittee for the American College of Rheumatology. I've been in solo private practice in Paducah, Kentucky for the last 10 years. The impact I've seen on my practice, I suspect, is similar to that seen by many of our members. My in-person office visits have dropped by about 50 to 75% in the last few weeks. Our governor's executive order actually precludes us from seeing anyone in person whose care is not urgent or emergent. We're still seeing acute new patients and established patients, acute joint injections, flares of disease, etc., and as many of our infusion patients as we deem safe and appropriate to bring into the office. In my solo practice, I have one PA and about 13 employees. In the last few weeks, I've had to furlough one of my receptionists and one of my nurses with hopes that we'll be able to rehire them when the crisis is over. I put my application in the first day I was able, and I encourage others to do the same. The program is intended to support small businesses with fewer than 500 employees. The loan can be for up to 250% of your monthly payroll costs, including salary, benefits, payroll taxes averaged over the last year. One caveat is that anyone whose salary is over $100,000 is capped at that amount for the purpose of the loan calculation. These funds are intended to cover payroll, rent, and utility costs over the 8-week period after the origination date. Any SBA lender can be used. My application's been handled through my local bank, and many local banks qualify. Consider asking your local lender first as to whether it's participating in this program. By maintaining original staff and salary levels, most or all of the loan will be forgiven. Specifically, if staff salaries are not cut by more than 25% and at least 75% of the total loan is used for payroll-related costs, 100% of the loan will be forgiven. If more than 25% is used for non-payroll costs, or if staff is reduced, or if salaries are cut by more than 25%, there will be a portion of the loan that needs to be paid back. That portion is dependent on how much you exceed each of those thresholds. Any amount not forgiven would be payable over 2 years, starting after a 6-month delay with a 1% interest rate. Any staff laid off before loan origination would need to be rehired by June 30th. My office manager worked with our accountant to calculate our payroll costs. We filled out the form that's listed in the link below this video. We must attest that we reasonably expect the current crisis to create a hardship for us, and that we're using the money to fund our payroll and keep our employees employed. Overall, the application was fairly simple to complete. However, there is some concern as to whether demand for loans may outstrip allocated funds, and it's unknown whether further funds may be allocated. The bottom line is to get the application in as quickly as possible if you think you would benefit from it. The ACR has put together a frequently asked questions resource that goes through some of the finer points. That document link is shown on the screen, and any questions can be sent to covid@rheumatology.org. You can also begin discussions with local lenders that are approved to give out these loans. They can help you walk through the steps as you navigate your practice through these uncertain times. Best wishes to each of you, and remember the ACR is here to support you. Thank you.